that colon cancer would, common side effects that colon cancer patients would experience, the common causes of it, and also tips to manage, as well as the chemotherapy safety that you can take care at home. So to start off, there are actually various types of treatment that colon cancer patients would go through. The most common one, especially in the early stage of cancer, would be surgery. And that's the main treatment where the tumor will be removed from the colon. And also there will be involvement of removal of surrounding healthy tissue and lymph node. And the second one would be radiotherapy. That is more commonly used among rectal cancer patients. And in this radiation therapy, it will be used to destroy cancer cells in the local region. And because of the radiations, it may also damage the healthy cells nearby the treatment area. Other than radiation therapy, there are also medications which can be used before or after the surgery, and that includes chemotherapy and targeted therapy. So in chemotherapy, it actually attacks on the rapidly dividing cells, which is commonly cancer cells. But because there are also healthy cells that could be rapidly dividing, such as like our blood cells, like white blood cell, red blood cell. So at the same time, there is a possibility that it attacks the healthy cells all over the body. Okay, then for the last one, it will be targeted therapy. So in targeted therapy, it actually precisely identifies certain genes or certain proteins in the cancer, and therefore would causes less side effects and target on the cancer cells directly. An example would be like bevacizumab and cetuximab. So if you look through all the side effects in the list here, there are actually some common ones across the line, such as like fatigues, bowel irregularities like constipations or diarrhea, some skin changes like dry skin or hand-foot syndromes, and even mouth sore. And therefore, we will go through it one by one today. And before we know when we actually can manage side effects, we also must know when is the time that it is not under our control. We must refer to the doctors. So when you have a temperature of 38 degrees or higher, it can be a sign of infection, because like I said, chemotherapy can actually target the white cell count. So when white cell count is low, the immunity is low, and therefore there's a higher risk of getting infection. So temperature of 38 degrees Celsius or higher may be a sign of infection. Therefore, it cannot be taken lightly. It should be address it to your doctor. Other than that, symptoms such as chills, sweats, shivers, shakes, or when you have difficult breathing, must also be told to your doctors. When you have uncontrolled vomiting, meaning that usually when you're on certain chemotherapy and the side effect, one of the side effects is vomiting, the doctor would give you anti-nausea or anti-vomiting medications. So if let's say you take that medications and it is still uncontrolled, and that is when you have to go to the doctor. And in terms of uncontrolled diarrhea, when it is more than 4 times of loose bowel movement from your baseline, meaning that if let's say usually every day you pass motion 2 times a day, then after you got your treatment and then you have diarrhea more than 6 times a day, then it is time that you actually should tell your doctor about it. Next would be on pain, tingling, or discomfort in your chest or arms. That could be like damage to your nerves, which may also need to which needs to be told to your doctors, because that could be also a serious side effects of the medications. Yeah. So these are the points where you actually need to refer to the doctor. And now I will go into the side effects which we can manage one by one. So the first one would be on cancer-related fatigue. The usual signs and symptoms may differ from what you expect when you feel tired. Usually when we feel tired, it goes away when we rest or sleep. But in cancer-related fatigue, sometimes it doesn't go away with rest. And even if you drink coffee or tea, which contains caffeine, it may not help. And the symptoms may come on suddenly or sometimes last longer. So it is sometimes out of expectation. You may feel like out of energy or weak, but sometimes feel restless or had a hard time sleeping. The reason I'm telling you of all these signs and symptoms is never to scare you or to make you nervous about it, but more towards to prepare you mentally on this kind of symptoms are what we are actually may experience, and embrace new change and empower yourself on the tips that we can actually manage with it. Yeah. And there are also many other reasons that could actually cause the fatigue. Like for example, if you have infection, definitely you feel more tired. If you don't have taking enough fluid, there's dehydration, or sometimes you feel a bit depressed, anemia, you don't take your diet well, or losing weight and also losing your muscle mass can also cause fatigue. Yeah, so it can be multifactorial at the same time. So certain tips like that would actually help in managing the fatigue. The most effective one will actually be exercise. Although you may feel that it is very tiring to wake up and go out for exercise, it is important to acknowledge that we can always start small. So it depends on what is your usual activity like. If you don't usually go for any activities, you can even start with a 5-minute short walk around your home and slowly increase it to 10 minutes, 20 minutes, 30 minutes from time to time, depending on your capacity. And our aim is actually to increase the exercise level to moderate physical activity of 30 minutes per day, which means in a cumulative of 150 minutes per week, and strength training like weight training of 2 times per week. But never pressure yourself to go to this level in a very short time. It must be done in a gradual mood. Yeah. And because the fatigue itself can be so sudden and we cannot expect how it may happen, it is important for us to prioritize the activities that is most important to you. So with any activities that you already plan and prioritize, once you achieve it, that is a small win that we should actually celebrate. Also, like I said, nutrition and hydration can also affect the level of fatigue that you have. So eating healthy and well-balanced diets is also important. Try to take small meals regularly, especially when you have low appetite, because when you feel tired, sometimes you don't have much appetite, but it's good to have it regularly. And at the same time, drink enough water, 8 glasses of water per day, and try to monitor your weight. If let's say there is a weight loss that you realize, try to address it to your doctor so that they can refer you to the dietitians in adjusting or recommending the diet to help you to maintain the calorie intake. Fourth one would be to get a restful sleep. So prepare yourself to be in the sleep mood so that you can relax before your bed with no screen time. And if let's say when you wake up in the middle of night, try not to look at the time, just rest. And also if it's in the near late afternoon, try not to take any caffeine, coffee, tea, and alcohol. Of course, sometimes, sorry, that's meditation. There's a spelling mistake here. Or deep breathing can help to relax your body. And taking short naps is also good. It's just that try not to take the naps in the later evening, like later than 3 p.m. So then it won't affect your nighttime sleep. Okay. Bowel irregularities. I'll talk about constipations first. So how we know that we are actually constipated. The signs and symptoms will be we pass less than 3 stools per week, meaning that like after 3 days, you still haven't pooped. Yeah, or sometimes you have a very hard stools or blockage. But if it lasts more than 3 months, then we call it as a chronic constipation. Of course, after surgery, that would be the most common causes of constipation because the bowel needs time to return to the normal, to adjust back to the normal bowel function. But not only that, dehydration, not having enough fluids, or certain medications like anti-nausea, vomitings, or painkiller can actually cause constipation. Lifestyle is something where we can control, like low fiber food, or sometimes we don't really move much. And when we have the urge of going to the toilet, but we ignore it. And certain medical conditions like hypothyroidism, low thyroid level, or stroke may also cause constipation. So it is also important to discuss with your doctors with regards to this to know the cause of your constipation. Yeah, because certain times, right, when you are on chemotherapy, before the chemotherapy or after chemotherapy, they may give certain anti-nausea medications, which is by the intravenous route, meaning that they drip into the vein itself. So you may not know that you actually got the anti-nausea or vomiting medications. So how do we manage it? Usually the doctors would recommend or like give over-the-counter medications such as like osmotic laxative, where it actually draws fluid into your colon so that it soften the stool, like lactulose syrups or polyethylene glycol, in combinations plus minus with stimulant laxative. Stimulant laxative is medications which actually trigger your contraction and relaxations of your bowel so that it the poo will move across to poo lah. And the examples will be bisacodyl or senna, and or even stool softener. On top of the medication itself, the medications usually, when doctor give you, if you have 3 days without a bowel movement, then you can actually start on with this. Or certain times, doctor would straight away ask you to take straight away because of the medications that you are currently taking. And at the same time, lifestyle changes can also be done. Prune juice or prune can actually soften the stools. And at the same time, we can increase our fiber intake, like through rice, barley, whole grains, fruits. But if we are taking insoluble fiber, it is important to stay hydrated, drink enough water, because fiber can actually increase the bulk of the stool. So you need water to make it move across the bowel. And of course, exercise, increasing your physical activity can also trigger the movement of the bowel. Next, in terms of diarrhea, it is also a very common side effects experienced in at least like 13 to 50% of the survivors, and it's usually caused by chemotherapy or radiotherapy. The signs and symptoms will be 7+ of stool or watery stools per day. Sometimes you may have a bit of abdominal cramping. Because of you losing a lot of water, it can cause dehydration and you feel weak or dizzy upon standing. So it is important to know when is the time that it is serious enough to immediately seek for help in the emergency department. When diarrhea gets worse, more than four times from the baseline, or doesn't improve after 2 days, or when you have black, bloody, or bright red stools, or even abdominal cramping, because that could be a sign of blockage in your bowel. And things that we can actually manage from your diet would be to actually increase the electrolytes in your water, such as adding oral rehydration salt, drinking it with a cup of water to replenish fluid. At the same time, stay hydrated, sip warm liquids slowly throughout the days, and try to eat small meals and snacks regularly so that it doesn't force the stool to come out that fast. Make sure that the food that you eat is well cooked. So increase more soluble fiber like oatmeal, oat brands, and bananas. Plain yogurt may also help to actually build the life active culture in your colon, but try to avoid dairy products because that could possibly contribute to diarrhea as well. There are also foods that you should avoid, such as hard to digest food, like popcorn, raw vegetables, or certain gassy vegetables like broccoli, cauliflower, cabbage, Brussels sprouts, or leeks. Spicy food, greasy food, sugary foods, drinks, as well as alcohol, coffee should also be avoided to reduce any stomach irritations. Now, another side effects that is commonly experienced by cancer patients is skin changes. So sometimes you may feel that your skin is very dry, and one of the condition which we call hand-foot syndrome, it is when both of your hands and also feet is red and swollen, and it is accompanied with dryness, crack, and also peeling skin. Sometimes you can also see thickened or callous skin. And in more severe cases, it can cause tingling, burning in the fingertips and also toes. Therefore, you may feel pain. Yeah, it is commonly due to the anti-cancer therapy like capecitabine, fluorouracil, cetuximab, the targeted therapy, and bevacizumab. In mild condition, we can still manage it. However, if let's say there is pain inside, which actually limits your daily day-to-day activities, that must be informed to your doctors, because they might need to adjust your treatment dose for the symptoms to go away. But things that we can prevent or even manage is that when we are on this kind of medications, we try to use moisturizing cream twice daily. Avoid those that include any alcohol or fragrance. When you bathe, try to avoid hot water, use lukewarm water. And if you go outdoors under the sun, try to wear long sleeves with the sunglasses, and also hat to avoid direct sunlight contact. And at the same time, use sunscreen with SPF of 30 plus and above. Wearing cotton socks and also avoiding tight-fitting shoes can reduce the irritations that you feel with the hand-foot syndrome. And if it is necessary that you need to clean things with detergents or cleaning products, it is best to use a barrier glove when dealing with it. And because the hand and foot will be very sensitive to any rubbings, try to avoid activities that can cause frictions or rubbing or scratchings of that area, like even typing or like playing music instruments. And sometimes vitamin B6 may help, but it is also important to tell your doctors with regards to the symptoms. Okay. Next, for mouth sore. Mouth sore, it's because of the inflammations of the mucosa area in your mouth, and therefore sometimes it may cause ulcer in your mouth or even throat regions, and causing it to be pain. Okay, and typically happens 5 to 10 days after starting chemos and lasts for 1 to 2 weeks, but it differs from persons to persons. So the sign and symptoms that you may feel is actually pain or redness in the mouth regions. Sometimes it can be some burning sensations and difficulty in swallowing because of the ulcer, or even sometimes the changes in the saliva or taste, and in more severe cases can cause oral bleeding and infections. Of course, mouth sore, yes, it can be due to chemotherapy, but there could be also other causes like poor oral hygiene. We didn't take care of the mouth clean. Smoking, poor nutrition, poorly fitting dentures, and also dehydrations. So there are some tips that we can actually do to manage this and also prevent it. So first is to keep your mouth clean. Try to use the soft toothbrush and also fluoride toothpaste. You can rinse your mouth with 1 teaspoon of salt or 1 teaspoon of baking soda mixed with 1 cup of water. Just gargle it to clean your mouth, or even alcohol-free mouthwash. If you're using dentures, take it out when you don't need them and clean well regularly every day. If let's say the mouth is too painful to brush or having bleeding, you can just rinse your mouth and not brushing it. In terms of dental flossing, if you do it regularly, then you can continue. But if let's say bleeding happens when you floss, then you stop it. But if let's say during treatment, usually you also don't floss, then you don't need to start flossing. And to protect your mouth, one of the best things is to stop smoking if you do. And at the same time, always make sure your lips and mouth is moist. So applying lip balm regularly, sucking ice chips to keep your mouth moist, taking sugarless lollies can also stimulate the saliva, sipping water regularly, or even chewing sugarless gum. But chewing sugarless gum may not be appropriate for certain people because some may actually develop gas in your stomach region. So it depends on person to person. And also every day, if you can, check your mouth to see if there's any soreness, redness, or white area, because white area can be a sign of infections and also even bleeding. So these symptoms must be reported to the doctors. And in terms of eating and drinking, you can try to substitute things with like soft and moist food, easily swallowed food, such as rice, mashed potato, or scrambled eggs, and try to use those with calorie-dense food if you really have low intake of diet to make sure you make up the calorie intake. And sometimes using gravies or sauce may also makes the food softer and easier to eat. So if you are having mouth sore, it is best to avoid these items like spicy, coarse, rough food, crispy food, very hot or very cold food, sour food like tomatoes, lemons, oranges, fizzy drinks, carbonated drinks, or alcohol, smoking. And alcohol-containing mouthwash like Listerine should also be avoided because it can cause irritations to your mouth. So in terms of changes in taste, there are some tips that you can also do on a daily basis, like sucking on mint, lemon candies before eating. When you eat, try to avoid the metal spoon, use the plastic one or wooden one. If let's say the food tastes too sweet because of the alteration of taste, you can try to add some salt or add a bit more acidic food. Sometimes, right, you may smell certain foods that is very good. Even though you haven't tried it, it's good that you can try it to actually help with your appetite. Try to use or eat freshly cooked food rather than canned, and substitute consume eggs, fish, or beans rather than red meat because it can taste metallic. And if you're losing weight, like I said, have to inform your doctor with regards to it, so that they can refer to the dietitians for appropriate dietary recommendations. So these are the common side effects that I've gone through today. And in order to kickstart, how are we going to kickstart? Like if let's say we are on treatment, and then how do we manage our side effects? First, we have to ask our medical team what kind of side effects you should expect during and after treatment, because that really depends on what type of treatments and also medications that you have been prescribed. Additionally, if let's say you feel that you have been experiencing certain side effects or stresses that really impacts you negatively in your quality of life, you can also talk to your doctor in adding a palliative care expert to your team. So palliative care expert will actually help to improve the comfort of your cancer journey. It can be like in terms of pain management, and it doesn't matter what cancer stage is. It is not just meant for terminal cancer. Yeah. Okay. And then the third one is whenever you experience any side effects, please tell your medical team to keep them informed. And it is also good that if you can keep a notebook to track your side effects and the things that you actually do to help manage them, so that the doctor would also know how frequent or how severe the side effects has been like from the previous visits, and what are the things that actually can be given to you to manage it much better. And also remember that you are not alone in this journey. Always reach out to your friends and family, or even the support group, to get advice or even emotional support. And this is a symptom diary form that I just got from the Colorectal Cancer Alliance page. And you can actually tick on it so that you don't need to actually remember, oh, actually how many times they experienced certain side effects throughout the time when I wasn't like until the next appointment date. So this will be something that is good for you all to record down. So now I'll move on to chemotherapy safety at home. So like I said, chemotherapy, it actually destroy cancer cells, and also at the same time the healthy cells at the same time. So if you are actually taking chemotherapy as tablets, if you're taking it yourself, that is fine. But if, let's say, your family members or your carriers is actually giving you the medications, it is good that they use gloves when they're handling the chemotherapy tablets, and also wash hands thoroughly with salt and water after giving the medications. So if you you have been given with chemotherapy medications, it can be on a IV drip by insert into the veins, or even oral tablets. And the medications can actually remain in your body fluids for about 48 hours after each treatment, but some may stay up to 7 days. So from within 7 days of taking the chemotherapy, since there are certain steps that you can actually take care in the home, which I will share later. So before that, for body fluids, it actually includes urine, your poo, your mucus like your phlegm or saliva, your vomit, semen, or vaginal fluid. So these are the things that actually can be in contact with your family members and pass on to another person, and actually causing harmful side effects. So safety precaution that we can actually take care at home within 7 days after your chemotherapy is to, when you go to toilet after using it, you can close the lid, then only flush the toilet with full flush twice, then you wash your hands. If, let's say, you do sweat at night, it is good that you can put a cloth under yourself on top of the bedding, so you can wash it later on, or even wear incontinence pads or nappies. And if, let's say, you use incontinence pads, nappies, or colostomy bag, it is good to use gloves to put the items into the plastic bag and then tie it up, then only throw it in the rubbish bin. And if, let's say, you vomit within the 7 days, you can either vomit in the plastic bowl or in the plastic bags without holes, and try to use something that is barrier, the gloves, to empty the vomit into the toilet carefully. If you throw it into the toilet bowl, close the lid and flush it with the full flush. And in terms of washing of clothes, towels, or beddings with body fluids, it is recommended to wash it separately with a long cycle. So that is all for my presentations today. This is capecitabine cycle sheet that I got from online as well. I'm not sure it would be helpful for any of you here. If, let's say, you are not able to take your medications regularly based on the cycle itself, it can be a useful tool for you to mark on the days that you have already taken the medications, to monitor your compliance towards the medications. So that's about it. If you have any questions, let me know.
If you have any question, you can just unmute. Miss Shirley. I'm Sarah.
I'm Sue. Oh, okay. Yeah. I just want to ask a question. Yeah. Because I already finished my 12th cycle of chemo. So my side effects now is the finger numbness and the toe numbness. Yeah. Because I'm not on medication now. So I don't know how to ease this numbness and this thing. Yeah. On the toes and in the fingers. Yeah.
And have you told your doctor about this?
Yeah, she said it's part of the side
Correct.
effects of, but how long will it last? I think it's already been like coming to 3 months already, still having this numbness and yeah.
Because it actually differs from person to person. It can be like very short, a few days, or even up to a few months that the patients may experiencing nerve
Yeah.
pain or numbness. Things that you can actually do is like try to wear loose clothing so that it doesn't cause much irritation. Sometimes wearing like cotton socks also helps. And when you are sleeping with the bedding, not sure if it feels good with the bedding on. If it's not, then just keep your feet open.
Okay.
Yeah. There are just like certain tips that we can actually manage for the numbness and tingling, but it actually needs some times for the body to clear the side effects.
Okay. Is there any like vitamins or distinct supplements to ease the or help the
Sometimes
numbness?
vitamin B6 can help also.
What kind of vitamin B6?
Vitamin B6 is just a supplement to help with the
supplement. Is there a
but
brand
there are a
name?
lot of brands available out there.
Okay. Alright.
Yeah.
What about any they say got a nerve pill? Don't know whether it works or not. Is that it's like I don't know whether it's a supplement or a nerve pill that will help, they say.
It depends on how troubling it is with the side effects. Yeah.
It's not painful, but it's like very discomfort because it's like tight. It's very tight. So when you walk, you feel the discomfort. Yeah. The tightness on the foot, especially the foot. Yeah.
Like a bit of swelling like that. Yeah, it is.
Yeah. Is there anything to prevent the swelling? Is there any like diet control, or do you need to do that? No. So I just do massage. Yeah, the palliative nerve comes, so she will just do the massage for me, with the massage cream.
Yeah.
She said maybe it's just to get rid of the discomfort is all, but it still comes back lah. It's like it still comes back.
Yeah.
And then also I get very dry skin. Yeah, it's the thing.
Your line is breaking, Miss Tan.
But still the dryness, even though I drink a lot. Is it? Oh, okay.
Miss Tan, can you repeat
okay
again? Because the line was breaking just now.
Yeah. Oh, what was I saying? Just I forgot.
Just now you said that you have dry skin.
Oh yeah. This dry skin actually during the chemo time was really very bad because I cannot cut my nails. When I cut my nails, I'm bleeding. But now I don't get bleeding lah. But it's just that the skin is like it peels. It's like very very dry. Yeah, especially the fingertips. Yeah, even though I put a lot of cream and lotion, and even sometimes I use some oil to put because it's like so dry. I don't know what to do. Yeah.
When do you apply the moisturizing cream?
I apply the GV what do you call it?
QV cream. But how frequent do you apply it?
Actually, quite often, because when I see it dry, then I apply.
Yeah, I think that is good already.
But still, last time it used to work during the chemo time. It used to work, but nowadays it's like it doesn't work anymore. It's like those chemo time when I apply, it does like moisturize thing. But now it's like getting so dry. I also don't know what to do with it. Yeah, the skin is like very, very dry.
Maybe sometimes you can switch another brand.
What brand do you recommend? What brand do you recommend?
You can try a different sorts of brands. It can be like Cetaphil or like Sorbolin or like also am I now?
Because my skin
Those
is
that
sensitive.
are without fragrance and cream is good. And let's say if at night you can also put a bit of ointment. Ointment is like the oil type, but it's greasy. And you can cover it with socks or like
ointment.
But the next day when you wake up, make sure you rinse it off lah. Because sometimes
what kind of ointment is that?
Emulsifying ointments, like just normal. It's a moisturizing ointment. But because it is like oil
based,
oil in solid form, oil in solid form, so that's why it can actually last on your skin much longer. But sometimes it may not have the good feeling lah. That's why it will be good to just apply at night long, so that it covers.
Sometimes I also apply coconut oil also, coconut oil or aloe vera oil. It's like I do apply.
Aloe vera may be just some soothing effect lah, not much on moisturizing.
So moisturizing is like olive oil and all that can. Olive
oil. Sometimes those with ceramides like Ceradan also can help to improve your skin barrier.
Ceradan,
that's a brand
ointment form you mean?
If not mistaken, Ceradan it's mostly in cream form.
Cream, okay. All right. And then sometimes once in a while I do get rashes. Rashes, is it because of the immunity? Is it due to immunity?
It can be a lot of causes of rashes. But it can be also a type of skin changes. So you have to monitor it. If let's say it gets worsened, it must be reported to your doctors. Because rashes is a bit hard to know.
Hard to tell.
Hard to tell the causes.
Yes. Because at one time when I was doing the chemo, I was very low in immunity, so I get the ringworm. So the doctor had to give me the antibiotic.
Antifungal.
Antifungal cream. But not all antifungal. Sometimes you have to check with the doctor, right?
Correct. Yeah, they have to examine your skin condition as well.
Condition. But sometimes it's like it's quite itchy. Sometimes it's like so.
Miss Tan.
Sorry.
I do some.
What did you say? What did you say? Can you repeat again?
She gave me some tablets like histamine or antihistamine
to reduce itchiness.
I take it's like 3 times a day. I take morning, afternoon, and night. It does help lah. I mean, it's like at least you get to sleep lah. I mean, it's like not so itchy.
But sometimes dryness can also cause itchiness as well.
So I mean, it's like I also drink plenty of water. I take fruit juice, everything to it, but it's still very, very dry. I think maybe it's the after effects of the chemo.
It can be the after effects.
Because my doctor because during chemo time not so bad. It's like after chemo. I thought by the time 3 months the chemo reaction will like go off. It still stays in the body. It's like how long is the thing coming out?
It can be an after effect that is still ongoing.
Yeah. Only thing is, yeah lah, I said, because if it's on the legs, it's a bit difficult because it's like when you walk, I mean, I try to exercise. Every day I do exercise, but it's like walking. Sometimes it's like you can't walk too far because of the tingling and this thing, discomfort. So I can only walk like 2 rounds near my house here. It's like, outside, it's like, then I'll go to normally I'll do one big round my housing estate, but now I cannot, because I feel, I will feel the pain. I mean, it's not that pain, but it's very discomfort, It's like the pulling, the tightness, Actually, I try to wear socks, but the socks I put on is like, it doesn't help because it's like very discomfort also. I'd rather, like you say, just leave it as it is.
Yeah, but with the nerve tingling sensations that you have, you also need to take care if let's say you are not sure if you're cooking or things like that, like if you're cutting up, then you must be very careful.
So that's why, when I regulate the hot water, I always like make sure the water is not so hot. Before I put my finger in, because I scared that there's numbness, that I don't feel the hotness, get burned. That's the only thing.
Correct.
So I don't do much cooking because I mean no feeling how to cook. It's like hard to take the knife. So so I don't cook.
But in terms of exercise, it is reasonable lah. Like you can only walk like 1-2 rounds around your house. But also you can try like some exercise on the bed itself lah.
Oh yeah, I have a palliative nurse that comes. So she has taught me to exercise with the ball and that one. So I try to do it half an hour every day. I do that and do the breathing also. But after that, very tired. After that, I want to go to sleep.
It's okay. At least it feels like relaxing. Then it can help you to fall asleep. Also,
the most I can do is half an hour. She will teach me to do the exercise. That's all. But it does help lah. I mean, it's good. You need to exercise, otherwise, because I didn't put on weight for so long. Now lately I put on really. Because I lost so much from the beginning. I lost 20 kilos. It's like, imagine, from 62 to 42. Then it's like takes so long to put on. So after I think 6 months later only, after the chemo, then slightly put on, So my weight now is like 58. It's not so bad lah, because my normal weight is 62. So I put on a lot already. I put on a lot.
Good
because
job.
I'm eating well. Only thing is, like you say, the numbness is. I was thinking, when you want to go out, then you cannot walk so long, so it's very hard.
Have to find someone to accompany now.
I mean, can go, but it's very discomfort.
Totally understand.
Thanks for answering all my questions.
No worries. I'm happy to help.
So how do I address you? How do I, Miss Yeow? Miss Yeow, is it?
Yeow.
Yeow.
Miss Yeow, I have a question. Before that, thank you so much for taking time to prepare such a comprehensive slide. For some of us, we are more to like, not auditory, more to like, you have to see things. Thank you for this slide. It's comprehensive. I like it. That is number one. And I have a question. Please pardon my question if it's a bit sensitive, it's a bit personal. But my question would be regarding the radiotherapy session treatment. After the treatment, after the radiation therapy, we have menopause. Like for me, I'm rectal cancer. Is there any possibility or chances that we will get the menstruation again?
May I know what age are you right now?
I'm 41, sorry.
But how do you know that it is menopause?
Can
you ask the doctor about it?
I was told that one of the side effects would be menopause, but it's not like 100%. But
So
after the pregnancy, my menstruation stopped. It's about 1.5 year already,
Oh, okay.
right after the radiotherapy. So is there any chance, any possibility? Actually, I have no complaint, but this is just like out of curiosity.
To be frank, this is something new that I know, but I can do some research on this. It's just that have you talked about this with your doctors and what are their opinions on this?
No, like I said, I'm okay with it because
Oh, so you never discussed this with your doctors
no,
whether
because no, because I don't find it like a burden. I feel happy like without the menses. I can solat every day. I can puasa, so I don't have to worry about pets and all that. So I'm okay with it, but I'm asking out of curiosity, for some of the peers might have the same concern.
I can do a bit of research and then get back to you on this.
So, but honestly, I've never asked anyone. This is the first time I voice out this question.
Oh, okay. Thank you so much for trusting me on this.
Okay, no problem. I'm happy.
Yeah, but I'll look it up on it and let you know later.
Okay, thank you. So, and one more thing, I have a question from another peer. I don't know whether she's here or she left already. She's asking about your slide, if it can be shared in the group.
Can. I will share in the group.
All right, thank you. Is there any question? Is there any other questions from the floor?
Hi, Miss Xiao Hui.
Hi.
Hi, yeah, I have a question. I have not started my chemo yet. I'm going to start it next month. So my question is, I've seen so many people talking about the side effects. So I would like to know, are there people who are not getting side effect at all?
I think this really depends from person to person. Yeah, there is a possibility of that.
So what is the probability of not getting side effect?
The probability of to know whether the probability of getting the side effects, this has to be discussed with your primary medical team, because they will actually prescribe you with the chemotherapy and also like the overall treatment plan, and yeah, and from there then they will share with you the exact side effects and how commonly is that side effect would happen to you.
Oh, okay.
Yeah. So actually
means,
it's important to understand like how's your treatment plan, like what type of treatment is it like chemotherapy or targeted therapy, or yeah, and because different medications may have different side effects.
oh, okay. So means have to get myself prepared for the side effect. Okay. Okay. I'm actually now after operation, I'm now quite fit now. Actually waiting to start chemo. So during this period, I am actually working and also I cook every day for the family. So now if let's say I start chemo already, if let's say hopefully I'm still fit, then I still can cook for the family as usual, right?
Yeah.
So no pantang or what, like no, huh? Okay. Okay, yeah.
Everything
So
can
just
be just as usual lah.
as usual. If let's say no, not really side effect, or we feel ourselves fit, so life as usual lah. Okay. Can. Thank you. Yeah, that's all.
Nice.
Yeah. Okay.
Is there any other question?
Like there's no more questions from the floor.
I think it's crystal clear. You've given such a wonderful, comprehensive presentation to us tonight. Thank you so much.
It is just a humble sharing. Thank you everyone for your time.
Thank you so much
No worries, no
for
worries.
answering all our questions here. Thank you.
Hopefully next time, if there's more chance and I have more things to share, I'm willing to come back again to share with you all.
Thank you so much.
No worries.
Thank you.
Thank you.
If
Thank you.
there's
Thank you.
anything else, I would like to thank Miss Yeow and all the participants. And inshallah, see you again next week for another session.
Yeah.
Good night, everyone. God bless. Thank you.
Thank
Thank
you,
you.
Sarah. Good night.
Have a
Good
good
night,
evening.
everyone. Yeah.
Bye-bye. Good night.
Thank you.